losing, what services did we lose? What are we?
We haven't lost any services yet because Dr. Sai is stepping up to the plate and providing this private office. But the services that they offered were the most intensive care for people with advanced liver failure or liver disease.
The Liver Center is moving to Queens.
Liver Center is moving to Queens. Dr. Sai is moving to Queens with it.
And what are the roadblocks to that? There's Medicare or Medicaid problems. There's federal approval that we need.
Actually, for the Liver Center, there are no roadblocks whatsoever. The only complication we're having is we need to, as a community, hire a gastroenterologist, which is a liver specialist to support Dr. Sai. And Queens wants that person in place so that they have adequate support for the actual clinical care.
Were patients panicking at all, and what do you want to say to patients?
Yeah, patients were concerned. When you have a precipitous close of a facility, it's really scary. And so people who had needs every week, they couldn't wait for 3 weeks or a month to get a new referral, which is why it was pretty extraordinary that Dr. Sai and his team stepped up and said no matter what, they're going to provide the care, as did other specialists in this discipline across the state. But when you have the center itself closing, people don't know where to go. And that's why Queens stepped in very quickly and decided they would take this on. But Queens is very careful and deliberate and professional about these matters, and so though they're going to take this full staff on, they want to have adequate backup. And that's what we heard today was they want to have a backup gastroenterologist to provide some of the support.
What about the emergency appropriation that the legislature will be dealing with? How much is that? What's that
Yes.
for? Why?
There's an emergency appropriation that we're planning. Currently the number is $1.5 million. It would be specifically focused on getting monies to Queens to help with the solid organ transplant services. That, of course, will provide some ability to have extra support services for all liver disease and all kidney disease. I know that will make it more possible for them to quickly hire these individuals. The reason for the appropriation, just in addition to supporting what I feel is a priority for the state of Hawaii, as does the governor, as does the House and Senate leadership, is because in the first year, you're not able to bill for services provided for liver transplants or for other transplants. It's just a situation that exists in the government. They will get that money later, but in the meanwhile, we want to be supportive of Queens.